Thank you. So yes, my name is Sian Rogers. I'm from Crown Agents. I'm the head of health logistics there. I'm actually not going to talk just about Sierra Leone today. This presentation was actually supposed to be meant by my colleagues in Sierra Leone, but as you can appreciate with the current situation there, they weren't able to travel here. So I'm actually going to give you three different examples from approaches that we're using in Zambia, Nigeria, and in Sierra Leone. So today I'm just going to give you a short introduction to Crown Agents. I'm going to talk to you about how in Zambia we've improved staff conditions to improve morale, retention and performance at Medical Stores Limited. I'm then going to explain how we're planning to implement supportive supervision in Nigeria on the neglected tropical diseases supply chain in 3 northern Nigerian states. And then finally, I'm going to speak about our work in Sierra Leone, where we're building capacity with the National Pharmaceutical Procurement Unit. And I'm also going to comment on how the Ebola outbreak has affected our impact. So Crown Agents is an international development company. We're a limited company owned by a non-profit making foundation. We have offices and representation in around 40 countries, mainly in Africa and Asia. We work in partnership with governments, aid agencies, NGOs and private companies. Our services cross a number of different areas, but particularly in supply chain management, health system strengthening, professional training and financial services. But the thread that runs through everything that we do is capacity building. So the first example I'm going to talk to you today about is Zambia. So for the past 10 years, Crown Agents has been supporting the Zambian government, along with other development partners, to transform Medical Stores Limited, which is Zambia's central medical store. When we began in MSL, MSL was in a pretty poor state. It had been badly managed for a number of years previously. There was a significant lack of investment, and most stakeholders had lost confidence in the organisation. Most importantly, the workforce was feeling undervalued with low rates of pay. Conditions were very poor. There's high absenteeism, high levels of theft from the warehouse, and staff retention was very poor. At the beginning of our work, we were given the task by the government to turn MSL into a sustainable, efficient and demand-led organisation with a phased handover to national management. To do this, we set about a detailed programme of change. There are some examples of what we did on the slide, but most importantly, we set about a programme of capacity building and staff strengthening human resources. This was the underpinning theme throughout our involvement, and we took a number of different approaches. We first developed a strategic business plan to return MSL to what it was intended to be at its inception. We recruited Zambian nationals to join the Crown Agents management team, and we gradually transitioned these over to MSL employment. We offered them formal on-the-job training throughout the process. We also designed and implemented a development programme for staff from the top down, building capacity throughout the organisation. But probably some of the biggest success we had was working with the unions to bring pay in line with market rates. We increased staff incentives and benefits. This included things like pensions, performance-related bonuses, personal development opportunities, and even things that seem quite simple like free staff meals and a free staff bus. So once all these activities began to take effect, we saw a real difference, especially amongst the staff. There was an improved optimism, morale was high, people were happy to come to work, absenteeism improved, theft from the warehouse was reduced significantly, and MSL became the go-to employer in the area, which meant they were able to attract the best people to the organisation. The team were also better trained, they were more skilled, more confident, and for the first time in years, the staff felt valued. And finally, at the end of our involvement, Crown Agents transitioned all of the management positions over to competent and well-qualified Zambian national staff. So the next project I'd like to talk about is in Nigeria. So this is an ongoing DFID-funded project we have working with site savers to address 7 neglected tropical diseases. I won't try and pronounce them all because they're very difficult. And this is taking place in 3 northern Nigerian states, Zamfara, Katsina and Kano. So again, Crown Agents' involvement in this project covers a range of core functions that are shown on the diagram. But again, one of the key aspects for us is building the human resource capacity of the relevant supply chain staff working on NTDs. So to start this off, we conducted a thorough supply chain and human resources assessment of federal, state and LGA levels. And this was to identify what was needed for customised capacity building. So the high-level findings of the Human Resources Review pointed to a number of strengths and weaknesses in the existing setup. So there are a number of pharmacists at federal and state level who could be trained to support the neglected tropical diseases supply chain. And there's also availability of experienced store workers who could be trained further in warehouse management. On the other hand, there was a number of weaknesses. There are no written job descriptions for the staff. Lower cadres do not have clear roles and responsibilities. Performance management, particularly at the LGA level, was weak. And there's no knowledge sharing amongst the supply chain. So by analysing the findings of the Supply Chain and Human Resources Review, our team recommended a number of capacity building activities. Some of these have begun and some of them are planned for future years or future months on the project. So we've started off with on-the-job training and mentorship of the NTD coordinators and store officers, and other relevant personnel to sort of reinforce good storage and good supply chain practices. We have developed LMIS tools, storage and distribution, SOPs, and disseminated this information through a well-defined trainer of trainers at the LGA level so that they can flow this down to the frontline health workers. Our team plans to address knowledge gaps in supply chain management at the federal level by running a certified training course early next year. And our team has also recommended and written guidelines for the implementation of a supportive supervision programme at the LGA level. So the need for supportive supervision at the health facility level was a key recommendation of the Supply Chain and Human Resources Review. So our team are using the Marquez and Keene definition of supportive supervision, and this says that supportive supervision is the process that promotes quality at all levels of the health system by strengthening relationships within the system, focusing on the identification and resolution of problems, optimising the allocation of resources, promoting high standards, teamwork and better two-way communication. So the rationale for using supportive supervision is that it provides a quick and easily identifiable resolution of issues that could result in stockouts, overstocking and inefficiencies in the supply chain being addressed. It helps those involved in the supervision to perform their respective roles and ensure that good practices are adhered to in the system, and that monitoring indicators serve as a metrics for measuring implementation and progress on the supervision system. So finally today I'm just going to talk about our project in Sierra Leone. This is a project funded by UNICEF whereby we're working with the Ministry of Health and Sanitation to create, set up and manage an autonomous national pharmaceutical procurement unit. So the MPPU is an independent and autonomous body that has replaced these central medical stores. So throughout the project, a clear focus for us and for the government has been on the need to build capacity of the staff at all levels of the MPPU, with the aim being at the end of the project we will hand over to well-qualified and competent national management team. And this is the particular aspect of the project that I'm going to focus on now. So there are a number of capacity building and institutional strengthening activities that are underway or are planned for this project. The first being a local counterpart management programme. So we have counterpart managing directors, operations director and procurement director that have been appointed to shadow our team. For each counterpart, we've undertaken a skills and capability assessment to develop individual capacity development plans, which are renewed on a monthly basis. We've provided practical on-the-job training on effective supply chain management techniques. Some of the staff have attended accredited training courses such as effective procurement for senior managers and effective management skills. We've also recruited additional staff into key management positions at the MPPU, including finance, IT and HR. And then in the future, we have plans to arrange study tours for the counterparts to go and visit other well-functioning supply chains around the world, and also to deliver a corporate governance masterclass to the Board of Governors. So obviously I can't talk about Sierra Leone without mentioning the awful Ebola outbreak. Our in-country team has remained in Sierra Leone throughout the difficulties, and they are really committed to supporting the government and all the other aid agencies that are responding. Unsurprisingly, Ebola has hampered the progress of many of the capacity building activities that we plan to undertake on this project. I'd say the biggest difference for us is that we've switched from a long-term system strengthening type approach to an emergency humanitarian response. And this has flagged up the need for strong systems, procedures and infrastructure to be in place before the outbreak occurs. It's making it a lot harder to respond because those systems and procedures weren't in place beforehand. All capacity building activities are now limited to on-the-job learning only, because workshops and training courses have all been banned. Staff are extremely tired, they're working incredibly long hours, and it makes it difficult to keep morale up. However, the Ebola outbreak has actually given some opportunities to accelerate and intensify learning for the staff, who now have to make quick decisions, they have to manage pressure, and there's also presented opportunities for them to transfer onto other secondments. So just finally today, I wanted to finish with a quote from our Managing Director on the MPPU project, who has been writing a blog for our website. And I think this quote sums up the difficulties facing the people of Sierra Leone and those responding to the Ebola outbreak. He says that witnessing life during this time has been especially tough. There is an air of apprehension amongst the community. Healthcare is prioritised to the attention of Ebola, impacting other health issues negatively, including reproductive health. Communities, especially pregnant women and adolescent girls, are not attending health facilities for fear of contracting Ebola. Most markets and public areas have been closed off. Local schools remain closed and children are left with little to do during the day. The government's best efforts to tackle this situation have been to provide innovative education classes through media, including the radio, which has proved effective over the last 3 months. The price of goods has risen, coinciding with a diminished level of agricultural activity, making it difficult for people to purchase their everyday staples. If anyone's interested, the full blog is available on our website. But that's it, so thank you very much.